We are here today with Keith Elgart, who is the Chief Operating Officer at Concierge Choice Physicians. He's also an expert in the development of membership models for health systems and hospital groups and large medical groups.
Thank you for having me today.
So how do physicians who have these sort of membership programs in health systems that you're currently working with, how do they feel about their concierge programs right now? Is this something that is putting additional stress on them right now? Is it, how are they feeling about their concierge members, about their program? How's it working within their day-to-day practice?
The feedback we've gotten, we stayed very connected with all of our physicians and all of our members throughout this past year, and in general, but throughout this past year, the feedback has been just, so thankful that they had a program in place, right? These were the things that kept the lights on, helped pay the overhead, whatever those factors that went in, the things that they were able to do to keep their staff when patient volume disappeared, right? Patients stop coming in, they're not visiting, you're not billing. That's revenue, right? So you stop having revenue. And so these programs really helped, hold things in place during that time and kept staff employed so that they could keep, again, a practice is like a family. A lot of times the staff has been there just as long as the doctor. The patients like not only the physician, but the staff. And so this program being in place has been great. And then the added ability to stay connected and these things that they were able to do for their members and their traditional patients with the time that they had available because the program was in place. They have felt better about their ability to stay connected, keep everybody comfortable, and kind of be that guiding light, that kind of grounding force for their patients in what was is a global pandemic and a global scare from a health perspective.
From a patient perspective and from an individual physician perspective, I could see why this kind of medicine would be appealing, this approach to healthcare. But from a practice manager or from like a business administrator from a hospital, like how does this work? If a hospital system owns a whole suite of primary care practices, would every single primary care doctor need to offer this program? Because some doctors, I could imagine, maybe they're nearing retirement. They're not interested in getting started in something like this, or maybe they're starting their career. They have a more limited patient panel. How does this work from a business perspective?
Yeah, the beauty of the hybrid approach is that it is so flexible, whether it's within the system as a whole or within an office within the system. Let's say you have a health system and you have 10 primary care offices and one of them has 5 physicians in it. All 5 don't have to offer the program. The ones that are offering it, they don't all have to be the same size program, right? So you have flexibility in that. Maybe a physician says, you know what, in my day, I can schedule about an hour per day. Okay, well, we'll cap your program at 100 members, right? So if you could get to 100 members, you kind of stop it there. And that's the time you dedicate. While another one in the practice, maybe they only have 20 or 25 members, and then somebody else has another 100 or 125. So it's flexible from doctor to doctor, from office to office. You find some common ground about what the offering is so that it's comfortable across practices. But the flexibility that's built into it really allows it to be adapted to each physician and each office in the way that matches the patients that they serve. A health system, really, each office can serve a unique set of patients, right? Every office and every physician's practice within the office may be unique, even though they're serving a similar community. And so the program can reflect that physician and their relationship with their patients and how they deliver care.
So I think that's an important point. I just want to make sure that that's clear. What you're saying is that patients could have a concierge relationship with their physician at the practice that they attend. If that doctor offers the program within the health system. The health system isn't going to require people or physicians to move into an alternate location, and patients would have to be relocated there. Is that correct?
Yeah, the beauty of what we've seen in the success of these offerings at these health systems was decentralizing it, right? So not the idea that we're going to set up this new practice, and if you want this kind of service, you have to establish a new relationship with a new doctor at a
Right.
facility that's not the one you've been going to, right? So
Mhm.
patients are creature, they find a doctor they like, they want to stay with the doctor that they like. They know what it means to go back and forth to that office, how that office runs. And so you could have this kind of program at all the extensions and all the locations that exist for the system. So you kind of reach out to the community and you meet the patients where they are, as opposed to saying, if you want this, you need to change everything you're doing and come over this way. And
Right.
it's really it's a more patient centric approach to what's going on.
So I know that you work with a lot of health systems now. In your experience, what doctors, what kind of physicians are best suited for a membership model of care?
So primary care is the obvious starting point. That's that initial relationship that patients have. That's the person that's kind of, in the general sense, quarterbacking their care. And so doctors who have longstanding patient panels, longstanding relationships with those patients, they have a great opportunity to do this. But it's not only limited to primary care. About half of our current active physicians are actually specialists, whether it's cardiologists, endocrinologists, rheumatologists, gynecology. There's a lot of options in specialty care as well, where you have a long-standing relationship and ongoing care that you provide for a patient. If a patient has cardiology needs, they're going to their cardiologist as that primary person to speak to. There's a relationship there that can benefit from a concierge offering as well. The beauty in what we do, though, from our perspective, is every practice, every physician has an opportunity. And in the analysis that we do in that first stage before anything even, goes further than the initial conversation, we have an ability to look at a practice and see what that opportunity might be. And again, in a health system, it's great because everything doesn't have to be a certain size program or limited to the perception of which community it might be offered in or which office is the best one for it. It really varies. We work in cities and towns and state across the country that don't fit what some people feel is the traditional location that concierge is successful in. And we have some great, highly successful programs, and it's because of the strength of the relationship of the physician and the patient and the support of that health system behind them.
So what would you say are some of the benefits to the health system for offering this? I mean, we talked about just being able to offer the full suite of service levels to
Mhm.
patients in the community, and that's pretty clear. And obviously, revenue would be um, a clear benefit to the health system, the additional revenue from the membership fees.
Mhm.
But what would be what else would incentivize a health system to get started on something like this?
One of the key factors is probably physician satisfaction, right? I think the big scare across the U.S. is physician burnout and retirement, and um, you know our health system having an even greater shortage of physicians than we have now.
Right.
And so this is a tool that helps really take those physicians who want to deliver care in this way and have a portion of their day that's dedicated to that, right? So they get that kind of sense of going back to how maybe they thought medicine should be practiced or they used to practice way back in the day. But it allows that satisfaction to exist, and that goes a long way. Physicians need to continue to enjoy the work that they're doing and not get burdened by, we've seen in some cases just, high volume care can be burdensome, right? It can be tiring for a physician. And so balancing that out, right? It's not necessarily throwing one idea out for the other, but bringing some balance to a physician's day really encourages them to participate more in the system, right? They get a better satisfaction out of their daily work.
And they
And
probably feel like they have more control,
more control in their day,
Mhm.
a portion of their day that's dedicated to how they want to deliver, in addition to what they're doing already. But it's just that variation in the day makes the day go better for them, right? There's some satisfaction that they get out of that, and we have found that physicians who have a concierge program do sometimes extend their career longer than the path that they were on, or their fellow physicians within their practices do, because they find the satisfaction out of the work and the relationships that they're
And they can slow
maintaining.
down their pace for a couple of hours a day or during the week and practice that sort of personalized, relaxing form of medicine. So it's not all, rush,
Yeah.
rush, rush.
Yeah, again, it gives in certain scenarios, it just lets them become that sleuth again, right? They go back into detective mode, and the things that they're doing for everybody, but it just happens in a different way, and you see our physicians when we talk with them, they're just reinvigorated, right? They just have this light again in what they're doing, and just this smile to their face when they talk about their day and their practice and the patients that they interact with.
I could see how that return to the old school style of medicine would be really appealing for older doctors who are now employed by health systems. Maybe they had private practices before, and now it's kind of allowing them to go back to what they were doing or how they used to practice. What about newer doctors and
Yeah.
newer
Yeah.
doctors in the industry? The health system's always trying to recruit.
Yeah. So then I was going to say that's part two of that is right. So you have the existing physicians and the existing practices, but you have the new physicians coming in, right? And new practices that you're bringing in under the umbrella of your health system. And we find that a lot of the systems have said having a concierge option available and making it something that they can offer really helps on the physician recruitment side, right? There's a desire to practice in this way. There's a desire for this to exist. There's an understanding of this in the marketplace. And so when you're out trying to attract new physicians or acquire new practices, the idea that your system allows for this to occur and to occur in a way, again, with a hybrid approach, where it can occur without you having to dismiss your longstanding relationships to do this with your patients. It works really well. We've seen it. We've gotten feedback from systems about how this has worked in their conversations and has made them more attractive in the marketplace.
So just to sort of wrap things up a little bit, what would a health system do? Like a business administrator at a health system, let's say they're interested in possibly offering this sort of blended approach, the hybrid choice, to patients in their health system and working with their physicians. What would be like the first step? What's something that they would need to do to get started?
Sure. Well, the easiest step is to go to our website, right? www.choice.md. Connect with us. One of the great services we offer that's free of charge right out of the gate in our conversations and exploring this with health systems and business managers and practice administrators is let's take a look at the data, right? So if you have an idea that this might be of interest to you, let's match that idea and that interest with some data to support where and how it might work and to what degree. The hardest step, as always, is taking that first step and just reach out, ask that question, and start that conversation, right? Don't go off of the assumptions you might have based on what you've seen in other places. Let's look at your practice, your system, and really look at what the opportunity and availability is in your system.
Okay, well, thank you very much.
Thank you for having me today.